If you only know N-acetylcysteine from glow-up detox posts, you're starting in the wrong clinic. Real NAC pharmacology shows up in at least two concrete places: as a mucolytic that changes sticky airway mucus, and as a medicine used when acetaminophen overdose threatens the liver. The supplement aisle borrows those mechanisms and then stretches them into a general cleanse story. Our job is to keep the chemistry honest and stop treating every bottle claim like a hospital protocol. Start with context before dose chatter. Inhaled acetylcysteine in lung care is a prescribed mucolytic tool used with other treatments. Oral NAC on a supplement shelf is a different use case, with different habits, different oversight, and a different evidence bar. Same cysteine-bearing molecule family, not the same job description. If a claim quietly swaps hospital indication language into bottle marketing, that is the first red flag to notice.
Okay, but that is exactly how a lot of popular videos sell it. They talk as if NAC is a master antioxidant switch that detoxes everything. When those clips say potent antioxidant and anti-inflammatory like it is a personality trait, what are they usually smuggling past the chemistry? Mucus thinning, glutathione, or just a vibe?
The most concrete non-emergency story is mucus biology. Airway mucus proteins are cross-linked by disulfide bonds, and those links help determine how thick and sticky the gel feels. Acetylcysteine can help open disulfide bridges, lowering viscosity so abnormal secretions are easier to move and cough clear. That is a local rheology claim, not a mystical toxin vacuum for your whole bloodstream. Medline Plus places inhaled acetylcysteine with other treatments for chest congestion from thick or abnormal mucus in lung conditions such as chronic bronchitis, emphysema, asthma-related mucus problems, and cystic fibrosis. It is used on a schedule through a suitable nebulizer, and clinicians manage the plan. That is mucus management medicine, not a free-floating wellness ritual.
So does the capsule people buy online behave like the nebulized medicine used for thick chest mucus? Or are shoppers mixing delivery routes and then expecting the same cough-clearing effect from a swallow? Before people treat NAC like a harmless antioxidant vitamin, what precautions actually matter? If someone has asthma, takes nitroglycerin, has bleeding risk, or might be pregnant, is this still a casual experiment? Or is that exactly when you pause for a clinician review?
The glutathione angle is real biochemistry with a smaller promise than the ads. NAC can donate cysteine, and cysteine availability can limit glutathione synthesis. Glutathione matters for cellular redox balance, so precursor support is biologically plausible. Plausible is the key word. Raising a precursor pathway is not automatic proof that brain fog, training soreness, or aging complaints will move just because a label mentions glutathione.
Where does the acetaminophen overdose story fit in that glutathione picture? Is that the strongest medical use people hear about? And does it prove a weekend cleanse after extra pain tablets is somehow evidence-based?
No. Overdose care is the opposite of improvisation. If someone may have taken too much acetaminophen, or they're dealing with serious lung disease, supplemental NAC capsules are not the plan. Those situations need urgent medical evaluation and clinician-directed treatment. Borrowing antidote fame for a car checkout is how people confuse a life-saving protocol with a wellness accessory. Even outside emergencies, tolerability is less glamorous than antioxidant mythology and more useful. Gastrointestinal upset is common, and acetylcysteine can have a sulfur-like odor or taste that stops people cold. Clinicians also need the full medication list because interactions and bleeding risk contexts are part of responsible use. If the bottle is hard to keep down, that is practical data, not a moral failure to detox harder.
Then who is actually the better match for an honest NAC conversation? Is it someone with clinician-managed thick mucus physiology, or the healthy shopper chasing a detox identity because a thumbnail promised cellular rebirth?
Muscle and recovery marketing gets ahead of the literature. A systematic review on NAC and skeletal muscle health found signals in animal models for force preservation and lower oxidative and inflammatory markers, but human data were scarce and mostly limited to short acute fatigue recovery. One cited human regimen used 1,800 milligrams a day for 7 days. Interesting mechanism work, not a green light for sarcopenia self-treatment from a supplement haul. Neurology interest is another place hope outruns certainty. Reviews of NAC and glutathione in Parkinson's disease report preliminary signals on symptoms, redox markers, or imaging in small studies, including work linking NAC exposure with functional connectivity changes. Sample sizes are modest, methods vary, and authors call for larger, longer trials. For a viewer, that means a curious research lane, not proof that a consumer bottle is disease-modifying therapy.
Because dietary supplements are regulated differently from prescription drugs, does a clean label or a huge follower count ever turn NAC into a substitute for clinician-guided care, or should people treat those as separate systems that should not be blurred?
If someone and their clinician still decide NAC is worth a supervised try for a concrete reason, judge one pre-specified outcome. That might be clinician-tracked mucus burden, a study-defined symptom score, or another measurable endpoint you agreed on in advance. Vague detox feelings are a weak signal and invite false confirmation from expensive placebo storytelling.
What about the odd research corners, like stent biofilm studies or special oxidative stress populations? Should those niche signals widen everyday supplement use, or do they stay in the supervised research and clinic lane where dosing and monitoring are explicit?
Product quality talk should stay boring on purpose. Look for clear labeling, a reason for use you could defend clinically, and no disease cure language that outruns what dietary supplements are allowed to promise. Fancy branding does not upgrade a cysteine donor into an antidote kit. If the marketing needs hospital words to sell a shelf bottle, the claim has already drifted. So the honest compression is simple. NAC has real mucus chemistry pharmacology and a serious medical role in acetaminophen overdose care. Glutathione precursor biology is coherent, but outcome claims have to stay specific. Muscle and many wellness extensions remain early or overstretched. Remember one line: respect the mechanism, demand the matching context, and do not let detox language borrow hospital authority it did not earn.